So if you've been through a rhinoplasty where you've not had a great result, it's really important to have a good understanding of how to do your homework and how to choose the surgeon who's going to make it better for you.
Yeah, so first thing we'll tell you is if you're looking to have a revision, you're not alone. Like we've said previously, you're really about 20% of patients who end up having rhinoplasty and then asking for a revision. So you're not alone in this. First thing you want to do is sort of get rid of the guilt and sense of, oh my God, what did I do? And really start to look forward positively toward the direction you want to go. And maybe that's the first thing that needs to happen before you even look for a rhinoplasty revision surgeon.
It's important to really understand also what kind of category you fit into as far as revision goes. There are patients where the rhinoplasty result may not have been horrible, but they just didn't meet their aesthetic expectations. Maybe they and their surgeon didn't have good communication, or perhaps didn't have the same aesthetic goals, and they want to change in the way it looks. There are other patients where the rhinoplasty was over-aggressive, had too much cartilage or a bone taken out, they're having breathing functional issues as a result, collapse and other issues. So importantly, as to timing and other things involved with making the decision, you really need to also get an understanding of the particular surgeons you're looking at in terms of what their area of expertise is.
Yeah, so perhaps the first step after all of this is started is go back to your original surgeon if you have confidence in them. Make sure that, if it was just a miscommunication conversation, that's sometimes something that they can ameliorate and address. If you've lost confidence, if you don't think that that surgeon's right for you, a good place to start is to get your operative note. That really always helps the revision surgeon. And then when you do meet with your revision surgeon, it's really important to go over the what-ifs. I think when Dr. Linder and I meet with our revision patients, you'll hear us say, if this, then that. If we need this, we'll have to do this. And it's not from a place of not knowing. It's rather, after you have enough experience, you know that almost anything's possible. Sometimes the nose on the outside doesn't look too bad, and when you open it up, there's a lot of scarring, there's a lot of collapse, there's a lot of things missing. And other times it looks awful on the outside, and on the inside it's not as bad, and it's relatively easy to take care of. So you want to know the possibilities, and you want to know that your surgeon can handle those possibilities.
So knowing that they can handle that has a lot to do with their level of experience. So you should be able to see many, many examples of before and after pictures of their results, both in office and on the web, that show what they've been able to accomplish in revision situations, hopefully in a situation similar to yours, so you can have some confidence that they can really help you. And then during the consultation, like Dr. Sullivan said, there are a lot of what-ifs when it comes to revision situations. That being said, a really experienced revision surgeon should be able to examine your nose, look at your breathing, and really have a very good sense of both what was done, what went wrong with your previous surgery, and now what's going to need to be done to fix it in a really comfortable way to make sure that this is the last time you have to touch your nose.
You really want to make sure that whoever you go to, you feel comfortable and confident that this can be the last surgery, that they're telling you that they can accomplish the goals that you want.